What is autism? Autism, officially referred to as autism spectrum disorder, ASD, is a neurodevelopmental condition that affects how individuals communicate, interact socially, and behave. It is characterized by a wide range of symptoms and severity levels, hence the term spectrum. Autism is typically evident in early childhood and persists throughout life. Key characteristics of autism. 1. Social communication and interaction challenges. Difficulty understanding social cues, such as facial expressions, gestures, or tone of voice. Challenges in making and maintaining friendships. Limited eye contact or engagement in reciprocal conversations. Preference for solitary activities over group interactions. Difficulty expressing or interpreting emotions. 2. Repetitive behaviors and restricted interests. Repetitive movements, such as hand flapping, rocking, or spinning. Insistence on routines or rituals. Discomfort with changes. Intense focus on specific interests or topics. Sensory sensitivities, e.g., aversion to loud noises, bright lights, or certain textures. 3. Other features. Delayed or atypical speech development in some individuals. Advanced abilities in specific areas such as mathematics, art, or music, in some cases, referred to as savant syndrome. Variability in intellectual ability, ranging from intellectual disability to above-average intelligence. Causes and risk factors. The exact cause of autism is not fully understood, but research suggests it arises from a combination of genetic, neurological, and environmental factors. 1. Genetic factors. Mutations in certain genes linked to brain development. A family history of autism increases the likelihood. 2. Neurological differences. Variations in brain structure and function, particularly in areas involved in social interaction and communication. 3. Environmental factors. Advanced parental age, either parent. Prenatal exposures, such as certain medications or infections during pregnancy. Premature birth or low birth weight. 4. No evidence for vaccines. Extensive research has debunked any link between vaccines and autism. Signs and symptoms of autism by age. 1. Early childhood, before age 2, delayed speech or lack of babbling. Limited response to name being called. Reduced interest in social interactions, e.g., avoiding eye contact. Repetitive play patterns, such as lining up toys. 2. Preschool age. Difficulty in pretend play or understanding others' perspectives. Strong resistance to changes in routine. 3. School age. Challenges in forming peer relationships. Intense focus on specific subjects or hobbies. 4. Adolescence and adulthood. Difficulty with abstract thinking or interpreting social nuances. Increased awareness of being different, which may lead to anxiety or depression. Diagnosis of autism. Diagnosis involves a thorough evaluation by professionals, typically based on behavioral observations and developmental history. 1. Developmental screening. Conducted during routine pediatric checkups to identify delays. 2. Comprehensive diagnostic evaluation. Includes detailed assessments by specialists, such as developmental pediatricians, neurologists, or psychologists. Tools include structured interviews, questionnaires, and direct observation, e.g., the Autism Diagnostic Observation Schedule, ADOS. 3. Rule out other conditions. Hearing impairments, speech delays, or other medical conditions that could mimic autism symptoms. Treatment and support for autism. There is no cure for autism, but early and tailored interventions can significantly improve quality of life. Treatment focuses on enhancing communication, social skills, and adaptive behaviors. 1. Behavioral and educational therapies. Applied behavior analysis, ABA, focuses on reinforcing positive behaviors and reducing disruptive ones. Speech therapy improves communication and language skills. Occupational therapy develops fine motor skills and helps manage sensory sensitivities. Social skills training teaches interaction skills through role-playing and practice. 2. Medications. Used to manage co-occurring conditions like anxiety, ADHD, or irritability. Commonly prescribed medications include SSRIs, antipsychotics, and stimulants. 3. Parent and caregiver training. Helps families understand autism and apply intervention techniques at home. 4. Special education services. Individualized education plans, IEPs, for school-age children. Accommodations to support learning and participation in a classroom setting. 5. Supportive therapies. Music therapy, art therapy, or animal-assisted therapy can help with emotional expression and engagement. Living with autism. 1. Challenges. Social isolation, bullying, or misunderstanding from peers. Navigating transitions such as starting school, puberty, or entering the workforce. 2. Strengths. Many individuals with autism have unique talents, high attention to detail, and strong memory skills. Diverse contributions to society in areas like technology, science, and the arts. 3. Support networks. Autism support groups, counseling, and community resources can provide valuable assistance to individuals and families. Autism and co-occurring conditions. People with autism often experience additional challenges such as anxiety or depression, attention deficit hyperactivity disorder, ADHD, sensory processing disorders, gastrointestinal issues, epilepsy or seizures. Prognosis and outlook. The outcomes for individuals with autism vary widely, depending on the severity of symptoms, early intervention, and support. Many people with autism can lead independent, fulfilling lives, particularly with appropriate accommodations and understanding from society. Emphasizing strengths and addressing challenges holistically are key to improving quality of life.